Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
More research shows that having a good level of vitamin D in the blood or taking a vitamin D supplement helps cancer survival. People who have better levels of vitamin D have better cancer survival. This appears in JAMA Network Open, Journal of the American Medical Association. So what's the story with vitamin D and cancer? We'll go into that and more on this episode of Invite Health Podcast. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the chief scientific officer over here at Invite Health. So let's get cracking here. Studies have been coming out for several decades that vitamin D supplements or having higher blood levels of vitamin D, that's what I prefer to see. Not just taking a vitamin D supplement, but actually checking the blood level of vitamin D to see if it's reached a good level. Have been connected with a lower risk of several cancers, including colon cancer, rectal cancer, breast cancer, prostate cancer. But starting about 10 years ago, studies started coming out that people with higher blood levels of vitamin D actually survive cancer better, some serious cancers. Now, in a new study, in people with normal weight, the vitamin D worked. The vitamin D supplement worked. It was 2,000 IUs, 2,000 international units. But in heavy people, it didn't work. And there's a reason for that, and we'll go into that. So let's go through some of the data of vitamin D and cancer. This study came out in the British Journal of Cancer at the end of 2009. It was Harvard researchers. Higher blood levels of vitamin D may double survival rates for patients with colorectal cancer. I mean, that's powerful. It's the Dana-Farber Cancer Institute at Harvard Medical School. People with the highest average levels of 25-hydroxy vitamin D, it's also called 25-hydroxycholecalciferol, had a cancer-specific mortality, so half that of people with the lowest average levels. Now, let's explain what 25-hydroxycholecalciferol is. It's the storage form of vitamin D. It's not yet activated. Activated vitamin D is called 1,25-dihydroxycholecalciferol. This is 25-hydroxycholecalciferol. So, higher levels of vitamin D after a diagnosis of colorectal cancer was associated with improved survival in this study. Now, a meta-analysis of a group of studies that was reported in the American Journal of Preventive Medicine back in 2007 showed that people with higher blood levels of vitamin D had a lower risk of developing colon cancer. So it's not just surviving colon cancer, it's also the risk of colon cancer. So here was a meta-analysis from 2011. A meta-analysis, when done right, proves something either works or it doesn't work. Because they're taking a whole bunch of studies and grouping together the results, it makes the data much more powerful. So this is the International Journal of Cancer Research in 2011. Higher blood levels of vitamin D are associated with a reduced risk of developing colorectal cancer. That's a meta-analysis of observational studies. It was 9 human clinical trials. For every 10 points increase in level of vitamin D, the associated risk of colorectal cancer decreased by 15%. So that means if your vitamin D was 20 and someone else's vitamin D was 40, that person's risk of colorectal cancer would be 30% lower. Now that's pretty important. So let's talk about cancer survival. We already did one review of colorectal cancer survival, one study. So here's a review of cancer survival. They're looking at breast and colorectal cancer. This is in April 2014. And patients with higher levels of vitamin D, when they were diagnosed with either breast cancer or colorectal cancer, had an improved ability to survive the cancers. They had a better chance of survival and remaining in remission for a longer time compared to people who are deficient. So it was a meta-analysis published in the Journal of Clinical Endocrinology and Metabolism. It included 25 studies, 17,332 cancer patients. The researchers found that for every 10-point improvement in vitamin D levels, there was an improvement in the ability to survive cancers. So here's looking specifically at breast cancer. This is the journal Anti-Cancer Research. Breast cancer patients with higher levels of vitamin D in their blood are twice as likely to survive breast cancer than those with lower levels. It's a Professor Cedric Garland. He led the team of researchers. He's from the University of California, San Diego Medical School of Medicine. They performed a meta-analysis of 5 clinical studies, data from more than 4,000 breast cancer patients. Those with the highest vitamin D status had about twice the survival rate of those with the lowest status. So vitamin D is important. They believe that, well, first of all, vitamin D is needed for the immune system. So that's one thing. For the immune system to fight cancer or infection, you need a certain level of vitamin D. But vitamin D does more than that in cancer. It's also an anti-inflammatory agent in cancer patients. Cancer feeds itself by creating localized inflammation. It kind of hijacks the energy production pathway and creates inflammation and lactic acid. And here's the reason why. Healthy cells do not survive in a lactic acid or and here's the reason why. Healthy cells do not survive well in an acidic environment. So when cancer can hijack the production of energy and instead steer towards creating lactic acid, the lactic acid makes it harder for other healthy cells to survive. It clears out room for the cancer to grow and spread. So those are the thoughts of why vitamin D is helping people fight cancer. So this is a new study, and this kind of highlights more information on it. It's from JAMA Network Open. This is what I alluded to in the start of our conversation. Middle-aged adults who took low-dose vitamin D supplements, now it was 2,000 units, so I wouldn't exactly call that low dose, for 5 years had a statistically lower risk of developing metastatic or fatal cancer. This is a new analysis of randomized controlled human clinical trials. But here's the catch. It really wasn't working well in people who were overweight. So why would that be? When you take vitamin D as a supplement, you could give 100 people the same dosage, and the blood level improvement from the vitamin D supplements over time would vary from person to person. But it varies more dramatically in overweight people. It seems that the fat cells capture the vitamin D, and it never gets to reach where it wanted to go to improve your health. So overweight people with more fat, the vitamin D isn't getting to where it's supposed to go for its receptor sites. It can't help out the immune system, etc., and it's trapped in their fat. So they found that normal weight individuals derive the most benefit, a 38% reduction in the risk of developing advanced cancer, which did not really happen in overweight people. Statistical testing confirmed a significant interaction between body mass index, how much fat or how lean you are, and the effects of vitamin D supplements. Now, this is a Paulette D. Chandler. She's a medical doctor at Brigham and Women's Hospital in Boston. And once again, this is in JAMA Network Open, Journal of the American Medical Association. Vitamin D supplementation at the studied levels are much less toxic and lower cost than many current cancer therapies, according to the doctors. Substantial variation in the increase in vitamin D after administration of the same vitamin D dose has been well documented. It is hard to predict how much of an increase in vitamin D will occur when you give an individual supplementation. They said the increase is typically less in lean people and higher in overweight people. So this is a secondary analysis of something called the VITAL trial, and it focused on the outcome of advanced cancer defined as metastatic cancer that is spread, or fatal cancer, and the potential impact of body mass index on the effects of vitamin D. So the effects of how much fat you have in your body or how lean you are, how does this affect vitamin D? How does this affect your ability to not have severe cancer? The trial included men over the age of 50 and women over the age of 55. They were free of cancer at the start. They were given 2,000 IUs of vitamin D every day, vitamin D3, and fish oils, or matching placebo. It was almost 26,000 participants, almost 8,000 in the normal weight range, a little over 10,000 who were overweight, and 7,300 who were obese. And they were followed up for approximately 6 years. The key subgroup analysis focused on the incidence of advanced cancer according to body mass index. The benefits of vitamin D were limited to normal weight participants. They had a 38% reduced risk of developing cancer spreading or dying from cancer. This is so important. Vitamin D is important, and losing fat is important. Overweight study participants assigned to vitamin D had a non-significant 11% reduction in the risk of cancer spreading, advanced cancer, or dying from cancer. Obese patients, it didn't help at all. It's very important to lose that fat. It really is. It's also very important to take a vitamin D supplement. When people talk to me, when they discuss with me about their cancer and what supplements they should be on, I typically say across the board vitamin D and a good probiotic supplement for the immune system. In any event, thank you for tuning in to the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com. You go right to our landing page, right to our opening page, and you just scroll down and you'll see an icon for the podcast, and there's also for the radio shows. Please make sure you subscribe. Please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. I hope to see you another time on another episode of the Invite Health Podcast. Thank you so much for listening.